there, friends, and welcome to Season 9 of the Lighting Your Way podcast. This season, we are continuing one of my favorite parts of the show, talking with patients about their own personal journeys through the healthcare system. These are real stories from real people, sharing the ups, the downs, and everything in between. It is honest, heartfelt, and as always, it's a reminder that no one walks this path alone. So join us as we shine a light on the challenges and triumphs of navigating healthcare. Here's to another season of connection, compassion, and hope. Hi, Lighting Your Way fans. I'm Betty Long with the introduction to episode number 3 for this season, while also representing by wearing the midnight green and white of the Super Bowl champion Philadelphia Eagles. In this episode, we meet a woman named Emily who, after experiencing acute onset of abdominal pain, went to the emergency room one weekend, where, as with many patients, her life changed. Bring in multiple doctors, multiple surgeries, multiple admissions, along with the support of one of our guardian nurses, Lindsay Aliano, and you have the journey of Emily through the healthcare system. I hope you enjoy this episode. I hope you learn something from it. And as always, go Birds. Emily Koval, welcome to the Lighting Your Way podcast. I am grateful to have you here.
Thank you, Betty, and I'm super grateful for you asking me to be on.
Well, I think your story is a good one, so I look forward to exploring it with you, and certainly for having our listeners learn from your journey, because as from what I've heard, it's a pretty rocky journey. So let's get started with that journey, if you're okay with that.
Yeah, sure. Yeah, I definitely would put good in quotes when you said it was a good story.
Yeah, all right, good. That's true.
For sure.
Good point. Good point. A good learning story. How's that?
Yeah.
All right. So, Em, we are talking with patients just to, get in their words what their journey was like through the healthcare system, and certainly we are part of that journey. But what I wanted to do is just tee it up for us. What happened? What was the start of your journey? What brought you to the healthcare system?
Sure. So I would say probably over the course of 3, maybe closer to 4 years, I would have what I would call flare-ups, and they would be what I thought was my stomach area. And to me, I'm just thinking, I'm just getting an ulcer. But it was acute. Like, it wasn't chronic. It didn't happen all the time. It would be 3 or 4 months, maybe even 5 months at a time.
Okay.
In between these flare-ups. And I would just kind of ignore them. It would last for about a day, 48 hours at the most. Then they go away and I'd be perfectly fine. So, I got 2 kids. I got a full-time job. Getting a doctor's appointment with a GI, I was like, yeah, I'll do it.
Okay. What was the flare-up like? Like, what were the symptoms that you had?
So all it would be like more this burning, but not heartburn, because it didn't feel like it would go up my esophagus. It would just felt like burning, nagging, not stabbing, just annoying. And I've taken everything over the counter that you could possibly think of, the Pepsids, Gas-X, all that kind of stuff. Nothing helped. And
okay.
I took a food journal to see if it had anything to do with what I was eating or drinking, and there was nothing consistent with it.
Okay. And did you ever, I know you didn't go to a gastro, but did you ever talk to your primary care provider about it?
Yeah, I went to an urgent care one day that was pretty bad, thinking they could give me something for prescription, and they wouldn't. They just said over the counter. And I told my primary, and she said, that's weird that it's not being addressed, or it's not getting better when you take something. You should go to a gastro.
Okay.
And I didn't.
Atta girl.
So it was over the course of those 4 years that I would have them. And then on July 1st of 2024, I had one that was probably the worst I had experienced. Like, it just was taking over my mind.
Okay.
And that was probably like 1 or 2 o'clock in the morning. I still couldn't find a position to sleep. And I asked my husband to take me to the ER because I just felt like something was wrong at this point.
Okay.
And that's when I finally went to and everything started in that with my journey.
Okay. And when you went to the emergency room, what was that like? Did they test you? What tests did they run? What did they look for?
First, of course, they just give you pain medication. And then I believe they gave me like a Pepcid type medicine as well. But then they took the normal blood samples that you would, but then they did give me a CT because they knew something was going on gastro. They were thinking it was going to be gallstones or maybe a stomach ulcer.
Okay.
So that's really
right,
what they were
because you're
looking
young.
for.
You're young. You're healthy.
Yeah.
Right. Yeah.
Yeah. So
And
yeah,
what did they find?
So they went on the CT, which came back pretty quick, I guess, because it was so early in the morning. And they said, yeah, we do see just something small in your liver, but our biggest concern is that there is a pretty large lesion on your pancreas.
Oh.
And so at that point, they start talking, we're going to discharge you, but we're going to get you with oncology.
So they with the pain. I mean, so they decided to discharge you even though you were having pain, and they
Correct.
found this finding on your pancreas. Okay.
Correct.
Okay.
Yep. Yeah. So they had initially referred me to an oncologist that my mom had an experience with when she had breast cancer when she was in her mid-60s. And I went with her to this appointment, met this oncologist, and I did not like her. I did not like the way she talked about how chemo was so amazing, and I needed a second opinion. And it turns out she was wrong, and she didn't need chemo. So automatically I said, I'm not working with this oncologist.
Okay.
And then that's when I started doing research and contacted you.
Right. And was that research on Google by any chance?
Of course it was.
All right, Dr. Google.
Look at my history on Google.
Right. Hopefully the FBI doesn't get your laptop.
Yeah.
Okay. So this is early July, right? And
yeah.
And so we connect you with an oncologist who you then see, and I think one of our nurses went with you.
Yeah.
Okay.
So we made an appointment at same hospital group, just different location that has a better name.
Okay.
And we looked it up, and she had pretty good credentials. But at that time is when my nurse Lindsay came with me.
Okay.
When I met her.
Okay, right, because this is all coming. I mean, what we always find with patients that are experiencing a new diagnosis and something that potentially might be really scary is we want to slow things down so that the information's not coming at you so fast like a fire hose.
Yep.
And clearly going from the ER to then navigating who you're supposed to see and what you're dealing with, right? Because all you know is that there's something on your pancreas and maybe something on your liver. Right.
Correct.
Did the symptoms subside? Let me go back to that. Like between the ER visit and the appointment.
No, which was actually interesting because I had said that it was usually 3 or 4 months in between. I had that flare up on July 1st, and then I want to say it was maybe a week and a half later I had another one, which was very close to each other. That's when I knew this is
okay.
That's when I started to get a little bit more nervous too.
Right. Right, because before it was, months, right, between period.
And forget about it almost.
Right, sure, and it's like, oh wait, this thing, but a week and a half is like, uh-oh. So what was that? What was that appointment like with the initial oncologist?
So the initial oncologist, I had Lindsay and my husband came with me, and we didn't wait very long, but the first person we met was the oncologist fellow, and he was very nice, and he sat down and he talked to us, and I said, I'd already had some blood work that I'd already seen on my chart, so I was Googling what they meant, and he brought me down and said, Emily, this looks like it's out of range on my chart range, but when we see somebody with certain kind of cancers or other bad diagnosis, you'd see it way out on the range. You're fine. You're outside of a normal range, but this might be your normal. Those kind of things he talked me through, and experiences that other people have had with these types of lesions. So I felt very comfortable going into it. And then the oncologist came in, and she seemed to be extremely knowledgeable, but it went from I think everything's going to be okay. We just have to get more information from the tissue of the tumor we're going to treat this as stage 4 pancreatic cancer.
Yikes.
And that's when everybody's jaws just kind of drop.
Yeah, right. Because, holy smokes, that's a pretty significant diagnosis, right?
Absolutely. And Lindsay actually threw her a look, which I love that she did that. And she backpedaled after she said that. She said, well, let me go back to next steps, what we need to do. So I always appreciate Lindsay getting like that for me.
And what was the look? Let's get it. Try to describe the look for me.
I'll have her do it for you.
Okay, so the smoke's clearing a little bit in the room, and what transpired of that? Like, because they wanted to get a biopsy, right? Because that's confirming a diagnosis. So what was the next steps that you took?
Next steps were take a little bit more blood, and then go. And she set me up with set me up to set an appointment with a GI in the same area for the biopsy. And she also, on that day, wanted me to see the oncologist surgeon. But we waited for him. We sat and we waited, but he was stuck in a surgery, so we weren't able to see him that day. But luckily, the oncologist nurse said she did get to finally talk to that surgeon. He looked at my CT scan, and that's when she said he doesn't think it's as bad as we think it is. He thinks it's operable and that there would be very little treatment afterwards, which at that point I felt a significant relief after he had listed it and told her that.
Well, yeah. I mean, again, we try to tell patients and coach them that don't go on Google. Try to, again, slow it down. Try to understand what the next steps are, right? Because to just see something on an image doesn't confirm a cancer, right? You have to get a biopsy, right? So eventually you have the biopsy, right?
Yes.
And what was that?
So I had the biopsy I want to say it was July 30th. Now we'd made an appointment with a doctor, but there was initially another GI doctor, but his schedule was so far out that we decided to go with this doctor, which is fine. It's just a biopsy, just grabbing some tissue. And it was fine, in and out. I did feel that same exact pain that I was feeling in my stomach after he did that, which everyone then said, well, that's good, because then we know this is where the pain is coming from. It's coming from that tumor. So that also made me feel good.
Okay.
So that went perfectly fine. And then I think I waited about a week and a half in order to get the results back. And unfortunately, I was down in North Carolina on family vacation at the time. And you can't have a teledoc appointment when you're not in the state of New Jersey with the doctors that only in the state of New Jersey.
Right.
But thankfully to Lindsay, when I talked to her, she read it for me in her own terms for what she knows and made me feel good. Like, this is good. They're not seeing the words carcinoma. You're not seeing this metastasized. You're not seeing those sad words.
Okay.
But she said we need to talk to the doctor. So she gave a call to the doctor and said, you know what, she doesn't have to have a teledoc appointment. You could just make a normal phone call. And he did. And it was because of Lindsay pushing to just say, just call her. That's all you have to do. Like, it'll take
just talk to her. Right.
Yeah, because she's freaking out.
Right, yeah.
She's back on Google.
Uh-oh. He made an immediate call. No, stop.
Yeah.
And did that help, talking with him? Did he?
It did. It did for the most part. He basically read it. I mean, I feel like Lindsay gave me just as much of a good feeling as he did. So.
Okay.
Yeah.
So after that, what happened? So you're now we're into August, September?
Yeah. So that was mid-August, and when we had the appointment with the GI doctor prior to the endoscopy, we noticed that they had just scheduled my surgery with the surgeon I hadn't met yet on August 13th, which is the Tuesday I was getting back from vacation on a Sunday. And I haven't met this surgeon. I didn't know what was going to be happening next, so I canceled it. And I said, I am not ready for this. I'm not prepared. I don't know what's happening. I haven't met this guy. I've only talked to him on the phone. So we canceled that one.
Wow.
And then
Had
eventually
they
made
communicated to you about the surgery?
No,
Or they
no
just
one
put you on the
had.
schedule?
No one had. Lindsay and I happened to go on my chart and looked at my following schedules, appointments, and it was on there. No one ever called me to tell me that August 13th was the date, and any of my pre-op stuff that needed. The next day, someone called me and told me, you got to do all this, and that's when I canceled it. I said, we have to reschedule. I can't.
Oh, wow.
It's too close.
This has not been, well, it was not for the first couple of months, a very smooth process. As we said, it was a little rocky, right?
It was. It definitely, and it only gets better, Betty. It only gets better.
which is why you're here, because we want to know how, right? Anyone else, like, to understand what I guess the normal process, because there is a normal process to how things should go, and that wasn't your experience. Right. It felt like it was constantly, a left turn, a right turn, a hiccup, a pothole. There was a lot of things that you had to deal with before you got to today, right?
Oh yeah.
So you have the surgery.
Yes. So, well, we reschedule. I meet the doctor. He tells me, he says there's many flavors to this tumor. And I think what you have is a good flavor, and we'll just take it out, and it's going to be fine. And there'll be unlikely any follow-up treatment. You'll be in the hospital for 3 to 5 days, and then you'll be a little sore. So then September 3rd comes, which is my scheduled surgery, and unfortunately I wake up in the ICU because I had a anaphylactic shock reaction which we're still not 100% sure what it is. But either the antibiotic or the muscle relaxer component in the anesthesia.
Oh my God! You'd never had surgery before? I guess your kids
just my wisdom teeth. Yeah, both of my kids were natural.
Wow.
So never
my God,
had
how
experience
scary!
that.
Yikes!
It was. Yeah, I blew up like a balloon. But so then, luckily that was a Tuesday, and luckily he was able to get me in Friday morning. Because the swelling went down, and they were able to take all my things were starting to come back down, all my blood results.
Yeah.
So they were comfortable, and they changed everything. They didn't do any latex. They changed the antibiotic, and they changed the muscle or the actual anesthesia. So you must
have been scared to death, right? Like to go into surgery.
Petrified to go back under. Petrified. Wow. Of course, I had a different anesthesiologist. I think they were watching me more like a hawk when they were in there. There was a lot more attention. And I definitely got some anti-anxiety medicine before I went in.
Had a girl. Wow.
But luckily, whatever it was one of those 3 things that was removed because I came out and, I was in recovery.
Wow. Okay. Phew. All right. Then.
Yep. So then I would say I think I was in the hospital for 4 days, which was in between what he said. The pain was a lot more than I was expecting. When they go in for abdominal surgery, they blow you up with gas to be able to move, the robot around, and they can't take everything out. So that passage of all that gas that's just floating around in your abdomen, it's not even in your digestive system, is an extremely painful thing that I was completely unaware of. It went up to my shoulder. It would just be these sharp pains. It had me in tears many times.
Yeah.
And I just kind of wish I was more prepared for that. And I wish I didn't even know I was going to have a drain. I should have known because my mom had a mastectomy, and she had a drain, but I didn't. So I woke up with this drain on the side of my hip that I didn't know was going to be there. So again, just some information I was not made aware of.
Yeah, and Emily, you're saying I should have known. No, and we should have. We, being the healthcare system, should have communicated that. See, that's part of the lesson in this is that you are the patient and you're not supposed to know what is normal and what isn't normal, and to be afraid to even wake up with that anaphylactic reaction in the ICU, and then to go back into surgery, and then you wake up again with things that you don't know because no one told you, right?
Exactly. Exactly.
Because, I remember when I was a staff nurse in the ICU, and they would often, when they were doing open heart surgeries, they would bring patients in sometimes to say, you want to see what it's going to look like in the ICU,
Right.
and do you want your family to, so that people
Wow.
understood what it was going to be, because you walk into a ICU after your loved ones has open heart surgery, and they're hooked up to everything, right? And it's scary.
Yeah.
So
I would have
I don't know.
loved
I
to
don't
have
know where
had
that's
like,
gone in surgery,
no.
but certainly your experience again proves that we can do a better job of communicating, for sure. Yeah.
And I didn't need him to give me the most worst case scenario, but I did want to kind of know these things are possible. It sucks. It's part of surgery. We'll get you through it. The nurses are going to be great. Not you're going to be in there and then you're going to be a little sore when you go home. That's it.
Right. Right.
Like
Right.
that was a huge difference.
Yeah, I
I was
mean, he's
not prepared.
minimizing it, and you're,
Very
I
much so.
usually, right, like doctors will tell you the worst case scenario, so that when you do better, it's like, oh, I did great. Look at me.
Yeah, like that wasn't as bad as he was talking. I would have so much preferred that. And then him
Right.
coming in being the hero, more like, and be like, he did such a great job. I wasn't in that much pain.
Right, right. So this
yeah.
journey is still ongoing?
It is. So another part that I was unaware of that is a issue that can happen shortly after a surgery. In particular, let me back up, because I didn't know until I was going in for the second time. The first time on September 3rd, I was not made aware. But on the second time, they told me I was going to have my spleen removed. It wasn't until I was in the robe, lying down, hooked up, that I was being told that my spleen was going to be removed, and that there was going to be some things I'd have to do afterwards, like immunizations, because it's your first defense to disease.
Wait,
so
wait a minute. There's such a thing as informed consent, and that you have to sign a consent. Did they not
signed an iPad. I signed an iPad. I can't tell you what was on that, because I was, complete anxious mess when I was going in. They're not going to do it till you sign it. I didn't say, wait, hold on, let me just flip through these 17 pages on this iPad, and I signed. And much like probably a lot of people would. And I'm sure it was in there, but it wasn't until, and they weren't going to tell me on that first time.
Well, that's again, that it is incumbent on them, meaning the physicians, to explain it to you. And then say, look, and here, we may have to take your spleen out. We may have to, right? You're going to wake up, just to understand, because, when they get in there, they may have to, right? Because that's the nature of the, I'm sorry.
Right. And that was not expressed to me. And one thing my husband and I go back and think about is actually on the initial surgery date, I had scheduled for 7 a.m. No, I'm sorry. I had it scheduled for 12 and to be there at 10. At 6:01 in the morning, they called me and said, where are you? And I said, my surgery's not scheduled until 12. I'm getting my kids on the bus for their first day of school. And they're like, well, can you get here? And I'm like, so I drove myself to the hospital for my surgery. And they got me in so quickly, because, of course, he has another one, obviously, right after this. Like, they had 15 people all around me, and next thing I know, I'm going under. And the next thing I'm
my
in
God,
ICU.
Emily.
Little things like that there was no preparation, and I was so rushed at that time with something missed. With something missed. I don't know. That consent part of it, like you said, the discussion about the spleen was missed for sure.
Yeah.
So that kind of I didn't think much of it at that time, but now we go back and we think, that was too quick. And that was not fair.
Wow. There's so many things wrong with this. I don't know where to begin, but I mean, thank God you're out of it. You're okay. You certainly learn from it, but I guess I want to, there's probably a lot that you learned, but tell me what you think, how will this change you the next time, if God forbid there is a next time, to go into the healthcare system? How will it change you?
It's scary, because there's just so many things that could go wrong, that have gone wrong, I don't, and you rely on these doctors. You have no other choice. I can't go to India and just say, oh, I think I have a tumor on there. Can somebody else take it out? You have to rely on the providers that are here. I don't think I would necessarily change them unless like possibly if the cancer does return, I have to have another surgery. I would go to a cancer specialist for sure. But I would ask so many more questions, and I would make sure that everybody around me who's involved in this and who's going to be in the day-to-day asks as many questions as possible as well.
Right.
And I didn't do that.
Well, you were facing it oftentimes with your husband and with Lindsay or with one of our team. Like even then, like the expectation is that we're partnering with you, we're there with you. But when we're not there, it sounds like they were in an instance of, where I can't believe they called you and said, where are you? Like, wow. Hey, you're late for your surgery. Come on.
It's like, well, and I looked back at my emails and on my chart and everything. There was no phone calls. There was no, you would think they'd be calling and make sure they actually spoke to the patient. Wow. No one ever did.
And have you given the physicians any feedback? Like what have you done to kind of empower yourself with respect to this experience?
So the story doesn't really end there. So if that had ended there, I would have been okay. I would have, not been the happiest of everything, but happens. My French. Okay. But because there's been so many things that afterwards I had a fluid buildup from the spot that was left from the spleen that caused a lot of pain, then I was in the hands of that GI doctor that I had initially that did the biopsy. Oh. And I don't think he made the right choices by putting a stent in, and the stent ended up being infected. He had to go back in, clean that stent. Then he removed the stent and ruptured the fluid, and it was all over my abdomen. And then I had a 10-day stay in the hospital because of that. That's where my trust kind of just went completely off the rails. I don't, and again, you're at the mercy of them. They're the ones who are educated in telling you, these are the things that we should do, or should you be giving me an option? Or I really don't know. And my stay during that time was extremely frustrating because I would see multiple doctors, GI, infectious disease, the surgeon, and they all just said, sit and wait, just wait. So I just sat in the hospital waiting. And to me, that's not practicing. Like, that's not a medical way of handling this.
Yeah, it's not a treatment to wait, right? I mean, sometimes it might be to get better, but I mean,
or at
Emily,
least they could explain that to me, and they didn't.
Well, again, back to, this whole experience, it just wraps up with communication, right? There was none.
There was none. Like, someone needed to sit down and explain that to me, and they didn't until I changed GI doctors, obviously, and I went to a normal appointment just to explain the story, and he spent 45 minutes with me and sat down and answered questions and explained this to me. And I was like, I'm not an idiot. I have an education. You can use big words. Like, you don't have to say things in layman's terms. And Lindsay couldn't make that appointment, but you had sent over another nurse for me, and she was great. And she asked the questions, and actually that GI doctor was incredibly impressed with her. He loved her. He's like, I love this. What is this, guardian nursing? Like, I'm going to start on my own. So watch out, you have competition, Patty.
Oh, we got competition. Listen, I'm not afraid. There's plenty of opportunity. Everybody needs an advocate, so he can do his own thing.
Yep.
So literally, like, I hear a lot of stories based on the work that we've done and being done, 21 years. But I feel like your case encompass so many, I guess some mistakes, but clearly very poor communication, little to none, right? It's not that they were giving you bad communication. They didn't give you any at all. So,
I agree
but
with
it
that. Yep.
continued. Like sometimes we'll hear a patient, in an instant, maybe there was poor communication, but yours was persistent from July
Yeah.
to when did it finally resolve? When did you finally get discharged home
I
for
was
good?
finally discharged early December from my 10-day stay,
Oh
and then
my
I've
God.
seen doctors since then. And like I said, seeing that new GI, he's the only one that has given me good information.
Wow.
In
So
this,
5 months.
6 months. Mm-hmm.
5 months. So how are
Yep.
you feeling now?
Now I'm okay. I'm nervous because the situation with the fluid that builds up, they don't know, they can't come in and scan me every day to see what's going on.
Right.
So I'm living on a symptomatic lifestyle. So if I have a symptom that could be bad, that's when I call.
Okay.
And that's when they might give me antibiotics or they might bring me in depending on how bad it is. But this is normal, and I don't think that's an excuse for this. I don't think it's normal. And if it was, it should have been told to me earlier so I could have been prepared.
Well, and there's still, is there still an opportunity for you to get a second opinion or potentially a third opinion based on that,
Sure.
on that issue, not necessarily, the surgery or the lesion on that? Is that something you'd like to pursue?
I probably could go see another GI doctor and see what they would want to do. I think the only things you can do are just go for more frequent scans, which may or may not be approved by my insurance company, or they put in another drain in, which they had already done. I had the drain initially for the surgery, but then I had to have another drain in, a larger drain, which is painful and annoying and, gross.
Yeah. Yeah.
So I just kind of living with this and just hoping that it doesn't take over and it just dissipates because my surgeon said it will go away.
What was when will it go away? Like, give me a time frame. A year?
Nobody knows. Right.
Okay.
I don't even
Everybody's
exact dates,
an
tell me.
individual. Yeah.
Yeah.
What was the final diagnosis? You were saying cancer, but then I heard you earlier say that it wasn't cancer. So what was the final diagnosis of the lesion?
So that's where it also gets a little bit. So it's a differentiated neuroendocrine tumor.
Okay.
So it's a very slow-growing tumor that was on my pancreas, and it did move. And when they collected the sample in the surgery, it did move to 5 out of my 7 nodes that were near it.
Okay.
So I did ask the oncologist in a follow-up appointment, would you consider this cancer? And she said, yes, I would.
Okay.
So that's so in the beginning we weren't calling it cancer, but now we are.
Okay. And so what's the follow-up for you once you're recovered? Do you need to check in with the oncologist, get scanned every couple of years, or?
Scanned every 4 months. I have a follow-up scan, then 6 months, and then a year until for 10 years. It's a very slow-growing tumor, so that time period in between, hopefully, if it does start to move, it's not going to be like devastating.
Right.
But we do need to monitor it. There's no such treatment. Chemo does not work against this tumor. Surgery is the only thing, and then it's a watch and monitor.
Has the pain subsided? Are you done with the pain? Because I know you said you'd have these episodes and they would go away. And so has the pain subsided? You don't have the pain?
That pain has subsided.
Okay.
But because of the fluid that buildup, there's stacks of fluid that are sitting in my abdomen right now, I do get pain or more like a fullness, or like I feel like I have, like I'm a big bowl of jelly feeling.
Oh.
So
did they test the fluid?
They did.
Okay.
And when I went in initially, it was infected. So I was on multiple antibiotics. Multiple.
Oh. Of course it was infected, because it's just
of course.
really
like you couldn't expect anything
can go wrong, will go wrong with this case. Really? Like you must feel like you were cursed. Jeez.
I was. Of course it was.
Wow. So, okay, so what did you learn from this? To ask questions, right?
Definitely to ask questions. Second opinions are important, which we did. Lindsay was fantastic in order to get me an appointment with Memorial Sloan Kettering to get a second opinion on the cancer part. And they had the same opinion as the oncologist. But without her, I don't think I would have pushed myself to do that. So I'm glad that she did.
Okay.
And possibly, like you said, maybe even a second opinion on this GI situation that I have. So don't trust. I think I'm at the point where I'm like, I don't trust any doctor. Yes, they're smart people, but they're not necessarily the end all be all. And you have to trust your gut. Have to.
True. And particularly in your case, because it all started in your gut.
It was all my gut.
Right? Trust your gut.
I don't really trust it.
Truer words have never been spoke, right?
Yep.
And what would you say to the physicians who treated you if you had a chance to get them all in a room and talk to them? What would you say?
I would tell them that they need to spend a little bit more time with these people, because this might be the biggest thing. It's maybe the third surgery you're going to do in one day, but it's the biggest thing that's going to happen in possibly somebody's life, especially a 42-year-old woman who's not supposed to have pancreatic cancer, you know?
Right.
And It's not just like removing something on my skin. It was a major surgery.
Yeah.
And I think the follow-up is important. Don't follow up through my chart. Give me a call.
Right.
You know, I'm asking you questions and I'm not getting the right answers, and I'm going through the PAs. I want to talk to the doctor. That's what I want. And I need them to communicate to each other, especially when they're in the same facility. And I think that's the whole point of these big, huge conglomerates, is because they're supposed to be able to keep all the data, and the doctors are communicating and taking your healthcare as one. And I don't think that was happening.
No. And I mean, we were just talking about that today at the office, that we have all these electronic medical records, and we have patient portals, and we have my charts, but there's worse communication today than there was, say, 10 years ago, right?
I completely agree.
You know, what we hear a lot is patients who are in the portal, right? So they've gone under the portal, they see their results, and they haven't talked to their physician yet, because the portals are reporting pretty quickly and the doctors can't keep up, right? So you get the results of your biopsy and you haven't heard from the surgeon or doctor, whatever.
Yeah, and in one case we did receive, my last CT scan had read that there was a stent in between my stomach and my pancreas, which on November 18th, when I went to the hospital for the 10-day stay, the whole reason for that was because they pulled out the stent. So I'm reading that there's still a stent in my system, but nobody's telling me this. And I made multiple calls, and Lindsay made multiple calls. And it wasn't until probably about 7 o'clock that night that I got a message through my chart saying the radiologist read it wrong. It's a clip.
Oh, that must have made you feel good.
I didn't even know there was a clip. Like, you didn't tell me there's a piece of metal in my system I did not know that existed.
Oh.
So another piece of communication that I wasn't aware of.
Jeez,
and it was read wrong. So yes, that my chart is great, but it's also awful.
Right. I think there's a whole lot of things that were awful here. I am grateful that you are okay, first of all.
Yeah.
And that you are able to at least laugh a little bit about it. But I do hope that you don't have any other interactions with the healthcare system, that maybe a scan every now and then turns out benign and you can continue your life and grow old without having another issue with this.
That is my dream.
Yeah, I sure hope so, because as you said, you're young, you're healthy, and except for this awful 5-month ordeal, you've been living well.
Yes. Yeah, I definitely have. I haven't had an interaction with the doctors to that extent in my entire life. So It was all new, and it was traumatic.
Oh, I think I think the lessons that you learned we could share with any patient, but certainly when you're facing a scary diagnosis and a surgery, and to your point, an endoscopy, a biopsy, there's a lot of things that you went through that were invasive. And particularly the anaphylactic reaction, I mean, that had to scare you. And do you know, next time you have surgery, are there any precautions that you need to take?
So the system that I'm in, they have, it's flagged all over the place. These 3 things do not put in her system.
Okay.
But
Okay.
we still don't know necessarily what they are. So my husband and I know what they are. And I'm thinking of putting something in my, like, next to my license or something. If I ever had to have emergency surgery in Alaska, I want them to know not to use these 3 things.
Well,
So,
I think that is that's definitely a smart, because to your point, if it's one system and the system's not communicating with potentially another out-of-state system.
Yeah.
Right.
Yeah.
Well, what's ironic is that the doctors can't talk to you if you're in a different state, but the systems could, but we don't have systems that do that. So
yeah, exactly. So I'm on my own when it comes to that. So, everybody I know who could possibly be out of state with me, I would want them to know these things in case I was ever unconscious and they had to open me up. God forbid that will ever happen.
Right. Well, when they ask the question, have you ever had a reaction to anesthesia? You say, absolutely.
Absolutely, I have.
Where do you want me to begin? You have a couple minutes? I got to tell you a story.
I got to tell you a story.
All right. Wow. Emily, thank you. I mean, I feel like it doesn't. I just want you to feel more confident that the healthcare system is not that screwed up, but certainly in this 5-month ordeal, you certainly have seen the worst of it, I would say.
I really, really hope so.
Yeah. But thank you, and I'm glad you're okay, and thanks for taking the time to share your story with us. And I do hope that it empowers some other patients that are listening, and hopefully some physicians, because I think that some of our patients, when they tell their stories, the one of the things they often say is to slow down and talk to a physician. Slow down.
Right.
Right. To your point, what that point you made, this might be your 3rd surgery, but it's the only time I'm going to have it. Right.
Right. And
That's great.
They're getting a little bit too quick, and this is just what they do. And some of them are getting a little bit older, and it can be a little scary almost. Like maybe some of them need to retire.
Oh, listen, we have senators and presidents that should retire too, but can't make them do it either.
Exactly,
all right. Well, thank you again for joining me, and I look forward to staying in touch.
Thanks, Betty. And I just want to make a shout out to Guardian Nurses. What you guys have done has been amazing, not just for me, but for my husband. Did you call Lindsay? Did you call Lindsay? Talk to Lindsay. And she's just been like my right-hand person. And I would consider her a friend too, because we just laugh and joke when we're sitting around waiting for doctor's appointments. And I love it.
Well, that's what happens, right? Because at least we're spending time in getting to know you, and we can develop a trusting relationship. So and it also kind of fuels us that, like, hey, this is my friend you're dealing with here.
Yeah, I think it does become a little bit personal with her now. She's starting to get really mad. And no, she's already mad.
Right, she goes in mad.
Yeah, she does. She's ready. She's got her guard up.
She's your protector now, so.
Yep, absolutely. So I appreciate you for bringing her into my life.
Oh, well, I'm happy that we're here and doing it, because we love helping people. So thank you very much. And I hope we stay in touch.
Will do.
All right, kiddo. Take care.
All right. Thanks, Betty.
Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, YouTube, Spotify, and Stitcher. If you found our conversation helpful, please share it with your friends and leave us a review. You can learn all about how Guardian Nurses helps patients and their families when they need it most at our website, guardiannurses.com. So until next time, find some joy in your life and pet all the good doggies and kitties, and remember to tell your people that you love them.